This part of the temporal bone is called the petrous part of the temporal bone. Am I right? Okay. Now you're going to identify certain other things. Yeah. Can you tell me in this yellow part, what is this foramen that you see here? Easy. Foramen ovale. The smaller one, foramen spinosum. Any idea why is it called foramen spinosum? Why is it called foramen spinosum? Because it is closer to the spine of the sphenoid. Okay, this elevation that you see here, the smaller elevation, that's the spine of sphenoid. That is why it is called foramen spinosum. Okay, yes. Now what are these? Can you see these plates here? These are the pterygoid plates. The pterygoid plates. The medial pterygoid plate and the lateral pterygoid plate. In the medial pterygoid plate, there's one important landmark. Can you see this process here in the medial pterygoid plate? That we are going to call it as pterygoid hamulus. That's going to give attachment to the pterygomandibular raphe. Remember yesterday we saw the buccinator originating from the pterygomandibular raphe? Yes? Yeah. Now, why am I talking about all this? Yes, I'm going to tell you. This area, exactly this area, yes, what is it called? Which lodges the cartilaginous part of the auditory tube? It's called the sulcus tubae. Now you're going to tell me, what are the two bones contributing to sulcus tubae? The yellow color that you see there is? Come on, the answers please. There are two bones contributing to sulcus tubae. The yellow one is the greater wing of sphenoid and the pink one is petrous part of temporal bone. Okay, now you understood. Here the cartilaginous part of auditory tube is there. Now, tensor palatine muscle. The tensor veli palatine muscle. Okay, concentrate on my words. It's going to originate from, yes, the spine of the sphenoid, the sulcus tubae, and the lateral part of the cartilaginous part of the auditory tube. Okay, these three things. From the spine of the sphenoid, sulcus tubae, and the lateral margin of the auditory tube. It is going to wind around. It's going to come like that. It's going to wind around. What is this landmark here? I told you. The pterygoid hamulus. It's going to wind around the pterygoid hamulus. It comes here. It expands to form the palatine upper neurosis. Three things you have to remember for tensor palatine. Okay. Which it's related to which part of the auditory tube? Lateral. So when it contracts, what will happen? It will try to expand the auditory tube. And therefore, this muscle is also called the dilator tubae. Understood? Okay. So I can just simply tell tensor palatine is called dilator tubae, but you should understand it. Once you understand it, you will never forget. Okay. So it's arising from the sulcus tubae, from the spine of the sphenoid and the lateral part of the cartilaginous part of auditory tube. That's why it expands the auditory tube, dilates it, dilated tubae. And second thing I told you, it's going to wind around the pterygoid hamulus. That will give you a clue for identification of this tendon or the muscle in your image-based question. And the third one that I want to tell you, yes, what is its insertion? It's different, yeah? It's going to expand and form the palatine upper neurosis. This palatine upper neurosis forms the structural framework of your palate itself, soft palate, to which the other muscles are attached. Is that okay? Yeah. Now, the same thing, try to identify in the skeleton here. Can you see here? So this is the medial pterygoid plate, the lateral pterygoid plate. You can make out the foramen ovale, the foramen spinosum. This one is the spine of the sphenoid. Usually they get confused with the spine of the sphenoid and styloid process. This is the styloid process, okay? This is the styloid process. This is the spine of sphenoid, this one. Yeah, this is the omer. So here, remember, behind the, yeah, you saw the pharynx here, behind the soft palate pharynx. So this is the region of the pharynx. Okay. Now coming to the second muscle that I want you to understand, the levator veli palatine. Levator veli palatine. So the levator veli palatine, easy. It's going to originate from the medial aspect of the cartilaginous part of auditory tube. Okay. And then what happens? It goes, yeah, and inserts into the soft palate. But before that, it passes through a gap, an upper part in the pharynx called the sinus of Morgagni. I told you behind the soft palate is the pharynx. So above the superior constrictor and the base of the skull, you have a gap that's called the sinus of Morgagni. So the clue for identification of levator veli palatine is the tendon passing through sinus of Morgagni. Okay, guys? Yeah. So we have seen the names of the muscles of soft palate. We have seen the attachments of two important muscles that will give you a clue for its identification. Now you're going to locate the muscles here. Orient yourself to this picture. So this is the base of the skull. You can see here. This is your auditory tube, the cartilaginous part of the auditory tube. Okay. Now you're going to tell me what is A, what is B. Yes, come on. What could the muscle A be? Waiting for your response. Come on. Yes. You see the medial pterygoid plate here. You see the pterygoid hamulus. You see the tendon of this muscle winding around it. So A should be, yes. Very good, Dr. Sindhuja, Dr. Pavitra. The tendon, yes, that you see here winding around the pterygoid hamulus is tensa palatine. What is its other name? Yes, Dr. Vignesh. Its other name is dilated tube. Okay, lateral aspect of the auditory tube. And what is B? This is your superior constrictor muscle. What is the space above the superior constrictor muscle and the base of the skull? I told you this area is the sinus of Morgagni. And you see a tendon or a muscle passing through the sinus of Morgagni. So B should be, yes, none other than but levator veli palatine. Right? You can identify, if you get this point, you can identify the muscle in any picture. Okay, you got it? Yeah. Now coming to this, another important clue for your identification. You can see the levator veli palatine inserting into the palate, right? And in front of it and behind it, you see some fibers here. These are the fibers of palatopharyngeus. Okay. The palatopharyngeus originates from the soft palate as the anterior and posterior fasciculi. So this is the levator veli palatine. Okay. The anterior and the posterior fasciculi of palatopharyngeus, they sort of loop around the insertion of levator veli palatine. Okay, that's another clue for your identification. Yes. Now this is another muscle that you can easily identify. What is it? Musculus Uvulae. Something special about Musculus Uvulae? Yes. So the Musculus Uvulae, okay, it lies enclosed within the palatine upper neurosis itself. There's no bony attachment. It is sort of sandwiched between the fibers of palatine upper neurosis. Is that okay? Okay with this picture? So you have to identify tensa veli palatine, levator veli palatine, palatopharyngeus, and musculus uvulae. I'll show you another diagram here. Okay. So this palatopharyngeus is going to form the Passavant's ridge. Where is Passavant's ridge located? This Passavant is named after a German surgeon. Okay. So this is your nasal cavity. This is nasopharynx, the oral cavity. Behind that will be oropharynx. Coming to it, okay. And this one here will be the laryngopharynx. Yes. So where is the Passavant's ridge located? So the communication between the nasopharynx and the oropharynx, this region is called the Pharyngeal Isthmus. The anterior boundary for Pharyngeal Isthmus is by soft palate. The posterior boundary for pharyngeal isthmus is Preservance ridge. So what will happen? Contraction of the soft palate is going to elevate your palate and it comes in contact with the Preservance ridge and close the pharyngeal isthmus. Someone asked about sinus of Morgagni. I'll be talking about it in detail in pharynx, okay, in another few minutes. Yeah, that's the pharyngeal Preservance ridge. This diagram, you can identify all the 5 muscles of soft palate. Yes. So what is it? You see the oral cavity opened, right? The hard palate here. And this is the region of the soft palate. Can you orient here? This is the tongue. Yes. Now you're going to identify the same here. Okay. I'll label it and you're going to tell me what is A, what is B, what is C, okay, and then here, what is D, what is E? Yes, can you answer me? A. See, it's going towards the tongue. From the palate, what is this structure you see in the lateral wall of the oropharynx? Your palatine tonsil, right? Palatine tonsil. இது என்ன சொன்ன? இது tongue. Yes. So from the soft palate towards the tongue, that's the palatoglossus, the only muscle of the tongue that's not supplied by hypoglossal nerve. Palatine tonsil ku pinnadi poradhu. From the soft palate towards the pharynx, that will be, B will be palato, very good, Dr. Vignesh. Palatopharyngeus, right? C. What is C? C is easy, right? What is C? Yeah, towards the uvula, Musculus Uvulae. Come on, what is D? இதுல நீங்க கண்டுபிடிச்சிட்டீங்கன்னா அப்புறம் எந்த இமேஜ்லனாலும் கண்டுபிடிச்சிடலாம். D, yes, you see the fibers of levator veli palatine between the origin of palatopharynges. Yeah, very good, very good. That's the levator. Now E, yeah, what is the one left out? This is your pterygoid hamulus. That's the tendon of tensa palatine, which is going to expand and form the palatine upper neurosis. So E is tensa veli palatine. Okay. So anyone, if you have a doubt in this image, kindly let me know. It's very important to identify all the 5 muscles of soft palate here. Okay. So this is nothing but your palatine glands. Just one word about the palatine glands. The secretomotor fibers, the preganglionic secretomotor fibers comes from nerve to pterygoid canal. Okay. The postganglionic fibers is via the greater and lesser palatine nerves. The soft palate itself, we call it as a fibromuscular glandular structure. Fibromuscular structure. Fibro, you mean the palatine upper neurosis, which is nothing but the expanded tendon of tensa palatine. Muscles, the 5 muscles that you see here. Glands is all these glands, palatine glands, okay? The preganglionic fibers is nerve to pterygoid canal via the facial nerve, okay? Superior salivatory nucleus. And the postganglionic fibers is via the greater and lesser palatine nerves, okay? Coming from pterygopalatine ganglion. So the 5 muscles of soft palate. Another important thing which I will need to show you in this picture definitely. So you see the palatine tonsil here. What is the muscle contributing to the tonsillar bed that you see here? It's a very nice picture to show you the pterygomandibular raphe. Can you see this white line here? From the pterygoid hamulus to the mandible behind the 3rd molar. A very nice picture to show you the, yeah, this is the pterygomandibular raphe. From the anterior aspect of it, we saw the muscle of the face, buccinator, right? From the posterior aspect of it, a muscle which forms the tonsillar bed. The lateral wall of the tonsil, superior constrictor. Yes, guys. Okay. Yeah. Again, another image to show you the palatoglossus. Okay. Yes. So here also try to identify the muscles of the soft palate. You can see the auditory tube here. Now tell me what is A, what is B, and what is C? Sorry, not this one. Palate right here, this one. Previous two slides, Harish. This one, palatoglossus. This is the soft palate. From the soft palate to the tongue, palatoglossus. This one, you want me to repeat it again? Hope others don't mind. The 5 muscles of the soft palate that you can see here. This is the tongue. From the soft palate, in front of the palatine tonsil towards the tongue, palatoglossus. From the soft palate, but going behind the palatine tonsil to the pharynx, B, palatopharyngeus. C, Musculus Uvulae in the midline towards the uvula. Okay, these are the fibers, the cut fibers of levator velli palatine. I told you levator velli palatine, yeah, in between the anterior and posterior fasciculi of palatopharynges. So this D, yeah, D will be levator velli palatine. This I told you is the pterygomandibular raphe. A very nice picture to show you the pterygomandibular raphe. From the pterygoid hamulus to the mandible behind the third molar. So this tendon winding around the pterygomandibular raphe will be tensa velli palatine. This is buccinator. We have been seeing since yesterday its relation to pterygomandibular raphe. This is superior constrictor muscle in the lateral wall of tonsil. Okay. Okay, Harish. Okay, now guys tell me. The palatine upper neurosis is the expanded tendon of insertion of tensa velli palatine. Instead of putting MCQs, I've just put it as filler. Yeah. The muscle enclosed within palatine upper neurosis, I told you it's not going to have any bony attachment. Yes. Musculus Uvulae. All the muscles of the soft palate are supplied by Pharyngeal Plexus, except tensa palatine that's supplied by mandibular nerve. Am I right? Okay. Now a few words about this pharyngeal plexus. It's contributed by 9th, 10th. Okay, there's a controversy regarding the 11th nerve. Now the newer editions of Gray's Anatomy tell that there's no cranial component for 11th nerve at all. Research have shown that there's no separate fibers for cranial part of the accessory nerve and sympathetics. Okay, the motor component they're telling it's the vagus. Yeah. So gag reflex, all of you must be knowing, right? Where you stroke the posterior wall of the pharynx, you can see the elevation of the soft palate. Afferent component is via the 9th nerve. Efferent is the 10th nerve. Okay. What happens when there is lesion of the vagus? Yeah. The uvula deviates to the normal side. Yes. Because of the pull of the muscles of that side. Deviation of the uvula to the normal side. So here the lesion is on the, this is right, this is left. It's deviated to the left. So the lesion is on the right side. Okay with the soft palate? So you should know where the soft palate is. Given orientation to the soft palate. Anterior surface facing the oral cavity, posterior facing the pharynx. Okay. The 5 pairs of muscles of soft palate, its attachments, and then yes, you should be able to identify it in an image-based question. And of course, yeah, the nerve supply. We'll move on to pharynx. Okay. So the pharynx, what is the extent of pharynx? From the base of the skull, yeah, from the base of the skull up to C6 vertebra. So this anterior arch of atlas. This is the dens of C2, C3, C4, C5, and C6. Cricoid cartilage level, okay? From base of skull up to C6, we are going to call it as pharynx. What are the subdivisions of pharynx? Easy, no? Behind the nasal cavity, this is the region of nasopharynx. Behind the oral cavity, oropharynx. Behind the laryngeal inlet, laryngopharynx. Okay. Now, before we go on to the muscles of pharynx, get an orientation to the structure of pharynx so that it will be easier to understand. So the pharynx, imagine it's a food tube, right? So what are the layers from outer to inner in any GIT? Yeah, in any layer, the layers of the GIT, you know, right? You have an adventitia or areola coat on the outer aspect. Yes, this one here. And then you see the muscle layer. So the muscle of the pharynx is arranged as an outer circular layer, inner longitudinal layer. Now, what are the constrictor circular muscles of the pharynx? 3 in number: superior constrictor, middle constrictor, inferior constrictor. Yes, the inner longitudinal muscles, they are also 3 in number. What are they? Already you have seen palatopharyngeus, salpingopharyngeus, and stylopharyngeus. Okay, so we saw the adventitia, then the muscle layer. Inner to the muscle layer, this is the submucosa. Okay, and last one, the mucosa, which lines the lumen of the pharynx. Okay, now one word about each layer. The adventitia, that's the outermost layer which covers the constrictor muscles, that is going to form the buccopharyngeal fascia. Why is it called buccopharyngeal fascia? Because it not only covers the constrictors of the pharynx, it also extends to cover the buccinator. We saw yesterday, right? It extends to cover the buccinator muscle. Okay. So the buccopharyngeal fascia is nothing but the outer areola covering of the pharynx. Muscle layer, I told you, outer circular, inner longitudinal. The submucosa. What is the extent of pharynx? I told you, from base of skull to C6. So above the superior constrictor, you have that gap, sinus of Morgagni. Yes, from the superior constrictor to the base of the skull, this gap is going to bridge by this thickening of submucosa. It forms the pharyngobasilar fascia. Pharyngobasilar fascia. So what is pharyngobasilar fascia? Is nothing but thickening of submucosa of the pharynx. Okay, so you shouldn't confuse between buccopharyngeal and pharyngobasilar, right? Buccopharyngeal easy, it's going to cover your buccinator, so it's on the outer aspect. Pharyngobasilar from the base of the skull to the superior constrictor. Okay, and what about the mucosa? Mucosa of nasopharynx will be ciliated columnar, respiratory epithelium. Of the oropharynx and laryngopharynx will be non-keratinized, stratified squamous. Some understanding? Okay. Now coming to the muscles. Yeah. So in each of the images that I'm going to show you now, you're going to identify the constrictor muscle. You're going to identify the longitudinal muscle. And we're going to talk about the structures passing between the constrictors. Is that fine? So in this picture, the inner longitudinal, outer constrictor. Yes. So the inner longitudinal muscles, can you tell me? This is A, this is B, and this is C. I've labeled, you're going to tell me what is it. What is A? Coming from the, the sides of your auditory tube, we'll call it as, yes? Very good, Dr. Kavya. Salpingopharyngeus, right? B. What is B? Coming from the palate, going downwards, it's going to form the Preservance ridge. Yeah, palatopharyngeus. Yes, Kavya. Okay. C. What is C? What is the one left? This is your stylopharyngeus. Okay, stylopharyngeus. Yeah. Now all the three longitudinal muscles, they all form a conjoined tendon that is going to get inserted into the posterior border of the lamina of thyroid cartilage. Okay, is that fine? Yeah. Now we'll move on to the constrictor muscles. I'll label it. You're going to tell me, okay, this is A, this is B, this is C1, this is C2. Okay, so A, what is A? That's the topmost. So the three constrictor, superior, middle, and inferior. So the top one will be, of course, superior constrictor. Can you tell me where is it originating from? We saw the pterygomandibular raphe, right? The pterygoid hamulus. You see the pterygomandibular raphe. This is a buccinator. This is superior constrictor, right? Lateral wall of your palatine tonsil. So this gap above that will be sinus of Morgagni. B is coming from, this is your hyoid bone. Remember we saw its vertebral level yesterday, C3. So coming from the hyoid will be middle constrictor. Okay. C, C1, C2. C1 is going to come from your thyroid. Yeah, this is your thyroid cartilage. This is cricoid cartilage. Cricoid cartilage vertebral level is C6. So see, the upper part is the thyropharyngeus, right? And the lower one, cricopharyngeus. No difficulty in identification, right? Now, where are these constrictor muscles are going to insert? So they all fan out backward. Okay, they go backward. They insert into a midline pharyngeal raphe. Okay, yes. Now coming to the third point, the structures that pass between the constrictor muscle. Okay, so this part above the superior constrictor. So I'll draw the, yeah. So this is your superior constrictor, middle constrictor, inferior constrictor. Okay. So above superior constrictor, can you tell me what are the structures passing through? Yes, you see the auditory tube there. What is the muscle accompanying the medial aspect of the auditory tube? A here. That's the, no, that's what I want you to orient. Just see here. What is the other name for tensor veli palatine? இதுக்காக தான் ஆஸ்டியாலஜி பிக்சர் எல்லாம் போட்டு உங்களுக்கு நான் ஓரியன்ட் பண்ணேன். What is the other name for tensor veli palatine? Dilator tubae, right? Why is it called dilator tubae? Because it's on the lateral aspect, right? Yes, Dr. Sindhuja. So the muscle on the medial aspect of auditory tube is levator veli palatine. Can you see here in the picture orient pannunga? This is sagittal section. A is medial, B is lateral. Okay, A is levator veli palatine. Okay, so the structure passing through sinus of Morgagni, I told you, levator veli palatine. Okay, and then you have two arteries there, palatine branch of ascending pharyngeal artery. Where is the ascending pharyngeal artery going to come from? From the external carotid artery. That's the only medial branch of external carotid artery, right? Yes. And one more, the ascending palatine artery. Okay. Now, between middle constrictor and inferior constrictor. What is that between middle constrictor and inferior constrictor? Yeah, superior constrictor and middle constrictor. This is your stylopharyngeus muscle. Okay, this gap, right? The stylopharyngeus muscle. which is going to be supplied by glossopharyngeal nerve, the ninth nerve. So these two structures, they pass between superior constrictor and middle constrictor. Next, between middle constrictor and inferior constrictor, you get to see the thyrohyoid membrane. The thyrohyoid membrane is pierced by internal laryngeal nerve and superior laryngeal vessels. And lastly, below the inferior constrictor, yeah, you can see the tracheoesophageal groove. What is the nerve running in the tracheoesophageal groove? Recurrent laryngeal nerve, yes, Dr. Kavya, and accompanied by the inferior laryngeal vessels, which are branches from the inferior thyroid artery. Okay, yes, I'll be repeating it again in another diagram. So this is another image where you're going to identify the muscles. Okay, so this is your pharyngobasilar fascia. The pharyngobasilar fascia is a modification of which layer of the pharynx? Yes, please, come on. Mucosa, submucosa, muscle adventitia. In the layer of modification, pa. Histology image எல்லாம் போட்டு சொல்லி கொடுத்திருக்கு. Very good, Dr. Pavitra Sindhuja. The submucosa. Okay. That's the sinus of Margagni. So this is your superior constrictor. Inga the hyoid bone. Okay. So this is your middle constrictor. The thyropharyngeus part, cricopharyngeus part, the esophagus. Okay. Yeah. This another muscle that you can identify here. Can you tell me what muscle is this? இது என்ன சொல்ல முடியுமா? You see the ramus of the mandible, inner to the ramus of the mandible, நேத்து கூட பார்த்தோம் இல்லையா? On the inner aspect of the ramus of the mandible, that will be Swati, this is your ramus of mandible. When you clench your teeth, what do you feel here? Yes, Dr. Varuna, outer aspect of the ramus. Okay, clench your teeth and feel. Outer aspect of the ramus is masseter, 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 masseter. Okay, and on the inner aspect of the ramus will be medial pterygoid. நேத்து கூட காமிச்சேன் நான் அந்த CT imageல medial pterygoid, right? Okay, this is your styloid process. Coming from the styloid process, this will be the stylopharynges. Can you see it passing between the gap between superior constrictor and middle constrictor? It is stylopharynges. This one is stylohyoid. I told you this is hyoid. Going towards the hyoid, this is the stylohyoid. Stylohyoid pakatlaye, this one coming from the mastoid process, posterior belly of digastric. Confused? You want me to repeat it again? Just this part alone. Superior constrictor, middle constrictor, structure passing between the two is stylopharyngeus. It is styloid process. Can you see here? This one is stylohyoid, going towards the hyoid bone. This is your mastoid process, just below the stylohyoid, posterior belly of digastric. Right? Okay. This part is opened up. Now you're going to tell me, this is the auditory tube here. Yes, this is your levator veli palatine. This is your salpingopharyngeus, palatopharyngeus. What is this? Anyone? Enna இது? Aha. Orient to the picture, but nice, Dr. Swati, yes, for making an attempt. This is a posterior part of your oral cavity. What do you get to see in the posterior most part of the tongue? Posterior most part of the tongue. இந்த இடத்துல எட்டி பாக்குது பாருங்க. This is your palatine tonsil. This is palatine tonsil. What could this be? Tongue is divided into anterior 2/3, posterior 1/3, posterior most part, right? Anterior 2/3, you get to see the papilla, filiform, fungiform, circumvallate. What do you get to see in the posterior most part of the tongue? Part of your Walder's ring. Yes. This is your nasopharyngeal tonsil, the adenoids. Very good, Dr. Pavitra. Okay, so this is your lingual tonsil. Yes, lingual tonsil. Okay. Yeah, this is a very nice picture here. இதுல நீங்க இப்ப சொல்லி ஆகணும் what is A, what is B here. This is A, this is B. Come on, tell me. இத மட்டும் நீங்க புரிஞ்சிட்டீங்கன்னா superb. What is A, what is B? Yes, waiting for you. This is superior constrictor. The space above the superior constrictor sinus of Morgagni that is traversed by the tendon of A is, yes, very good, very good, very good. Okay, இப்போ புரியுதா எப்படி கண்டுபிடிக்கணும்னு சொல்லிட்டு. B will be tensor veli palatine. B is lateral. Okay, A is medial. Okay, orient. This is superior constrictor, pterygomandibular raphe, buccinator. This will be styloglossus. Okay, hyoglossus pachylinga. This is your middle constrictor. This is your thyropharyngeus part of inferior constrictor, cricopharyngeus part of inferior constrictor. So above superior constrictor, the four structures. Between superior constrictor and middle constrictor, stylopharyngeus and the ninth nerve. Between middle constrictor, inferior constrictor, the thyrohyoid membrane, pierced by internal laryngeal nerve, superior laryngeal vessels. Below the inferior constrictor, remember I told you, the tracheoesophageal groove, recurrent laryngeal nerve, and inferior laryngeal vessels. Okay. யாரெல்லாம் மதுரைக்காரங்க இருக்கீங்க? I'm from Madurai, okay? I settled down in Madurai. In Madurai, there's a famous dish here. It's called, anyone can identify this dish? Heard about it? Yeah, Vignesh, Lapa. Okay, so above superior constrictor, the structures passing through confuse ahavena. LAPA, Levator, veli, palatine. What is A? Auditory tube. What is P? Palatine branch of ascending pharyngeal artery. What is A again? Ascending palatine artery. Okay, others all you can fill it up, right? Easy. Stylopharyngeus and ninth nerve, internal laryngeal nerve, superior laryngeal vessels, recurrent laryngeal nerve, inferior laryngeal vessels. Okay, guys, I've repeated so many times. You should have it at the tip of your fingers in adikadi ketirukanga in different forms. Okay, it's a very high yield topic. We'll move on. Cherry. I'll read it for you, but I'm going to concentrate on just one term here. An 82-year-old female patient presented with progressively worsening dysphagia to solid food, regurgitation, globus sensation, halitosis. Barium esophagogram was performed and revealed a 40 mm anterolateral protrusion. In the oru vaartha da na concentrate panna poren at the level of Dr. Sindhuja. Okay, wait please. At the level of proximal cervical esophagus. Protrusion granale avasarapatingla. There are 3 protrusions, right? Because of her age and significant comorbidities, hypertension, peripheral vascular disease, cardiac arrhythmia requiring permanent pacemaker, she preferred to proceed with the least invasive intervention. Sorry, anterolateral protrusion. This is the one I want you to concentrate to identify what type of diverticulum is it. Three important diverticulums are there. Zenkers, lemur, okay, and one more, Killian Jamieson. Okay, so just with the position, you can tell this. Zenkers, you are very familiar with. Then how can you make a mistake here? Yeah, so where is the Zenkers? These are all mucus outpouching of the mucosa through the muscular deficient areas, right? Due to incoordination. Yeah, so where is Zenker's diverticulum? It is also called the Pulsion diverticulum. It's the most commonest type. So this is your Thyrohyoid, this is Cricoarytenoid. Yeah, yes, of course. Okay, because it doesn't involve all the layers. Yes, Vignesh. So the Zenker's diverticulum is found in the midline, yeah, posterior aspect of the pharynx, below Thyrohyoid, above Cricoarytenoid, or between the two parts of the inferior constrictor. We know that, right? It's very common. Frequent illadadu idudhaan. Lemur and Killian Jameson. Lemur is also midline. It is also posterior. Okay. But below Cricoarytenoid. Adavadhu Cricoarytenoid ku keela, esophagus ku mala. This one. Okay, this is your Zenkers. This is lemur. Anterolateral. Side la theriyudillaya. This is C. This is also below the Cricoarytenoid. Okay, but anterolateral. Cricoarytenoid ko esophagus ko nadula da, but not in the midline. Not on the posterior aspect. On the anterolateral. Is it clear? Names are terinjukonga. Zenkers, lemur, Killian Jameson. Yes, it has been asked, okay, once. Yeah, so midline posterior irukkiradhu Zenkers lemur. Zenkers is between Thyrohyoid and Cricoarytenoid. Lemur is between Cricoarytenoid and inferior constrictor. Anterolateral irukkiradhu Killian Jameson. Okay, now, yeah, this diagram, this image is very nice where you can draw it. Either Thyrohyoid, Cricoarytenoid, esophagus. If I put a mucus diverticulum here, what will you label it as? Yes, come on. Zenkers, okay. This one below Cricoarytenoid, what will you label it as? Either Zenker, yes, Kavya, Dr. Kavya, lemur. If I put a mucus diverticulum here, I will call it as Killian Jameson. Fine. So the diverticulums which are in the midline posterior. Okay, theory exam ki university la correct பண்ணும்போது என்ன கொடுப்பாங்க, question paper க்கு key கொடுப்பாங்க, right? Apart from that, I think that they should give a key for us for WhatsApp language. நம்ம நார்மலா இப்ப வாட்ஸ்அப்ல யூஸ் பண்ற டெக்ஸ்டிங்கே has changed, a transformation in the English there, right? A new vocabulary, a dictionary has to be produced for it. எனக்கு இந்த ROFL வந்து ரொம்ப காலமா தெரியாம இருந்துச்சு. This song is very educative, right? No? Yeah. So எதுக்காக இப்ப இதெல்லாம் பேசிக்கிட்டு இருக்கேன் அப்படின்னா, PLZ, midline, posterior, yes, lemur, and Zenker. That's the mnemonic. Okay, guys, please remember, please, for these diverticulum. Midline posterior irukkudu lemur, Zenkersum. Is that fine? Okay. All the muscles of the pharynx are innervated by Pharyngeal Plexus except Stylopharynges, that is innervated by the glossopharyngeal nerve, passing between the superior constrictor and middle constrictor. Yes, Dr. Vignesh. Pharyngobasilar fascia's modification of submucosa. It is also called the pharyngeal upper neurosis. Pharyngeal muscle contributing to tonsillar bed. Can I have the answer? Pharyngeal muscle contributing to tonsillar bed. Very good, Dr. Kavya. Superior constrictor. Pharyngeal muscle contributing to the floor of carotid triangle. The carotid triangle is very important, a highly topic. Adliyum floor muscles வந்து 4 திருப்பி கேட்டிக்கிட்டே இருக்காங்க. Pharyngeal muscle contributing to the floor of carotid triangle. 4 அதுல 2 வந்து constrictor muscles தான். என்னலாம்? கண்டிப்பா superior constrictor இருக்காது, right? You have the middle constrictor, inferior constrictor. Inferior constrictor comes from thyroid. So thyrohyoid. Middle constrictor comes from hyoid. So hyoglossus. Okay, இதுக்கு ஒரு mnemonic அடுத்து கண்டுபிடிக்கலாம். பாப்போம். Okay, so the 4 muscles which are contributing to floor of the carotid triangle. Inferior constrictor along with the thyrohyoid. Middle constrictor along with hyoglossus. Please remember, it's very important. And it is just to show you the superior constrictor muscle. Lateral wall of palatine tonsils. We'll move on to muscles of larynx. Yeah. Okay. Yes. So muscles of larynx, identify the cartilage here. This is epiglottis. This is your thyroid, cricoid. Sitting on top of cricoid, this will be arytenoid. Questioner slide, ma'am. Which one, da? Is this one, Vignesh? Okay. Cartilages of larynx. So whatever image-based question that's going to come now, okay, where you're supposed to identify the muscle, முதல்ல cartilage identify பண்ணணும். அதை identify பண்ணாதான் orientation கிடைக்கும், அப்புறம் தான் muscles பண்ண முடியும். Okay, so this is your epiglottis, right? This is the thyroid cartilage. This is cricoid, vertebral level C6. Cricoid வந்து பாத்தீங்கன்னா, that's the only cartilage which is going to completely encircle the larynx. Okay, which is going to completely encircle the larynx, cricoid. முன்னாடியும் பார்க்கலாம், பின்னாடியும் பார்க்கலாம். This is the cricoid. Sitting on top of the cricoid, this is your arytenoid. Arytenoid மேல இருக்க ரெண்டு குட்டி cartilage, corniculate and cuneiform. Okay, if you don't mind about the time, I'll just rush over this, important points related to it. Elastic cartilage of larynx என்னலாம்? Epiglottis, yeah, corniculate, cuneiform. They have asked it repeatedly, that's why. Arytenoid oda ocal process and apical process. The cartilages of larynx are mainly made up of hyaline cartilage, okay? Thyroid, cricoid, most of the arytenoid are made up of hyaline cartilage. The only exception is these: epiglottis, corniculate, cuneiform, and the ocal process and apical process of arytenoid. Yes? Yeah. So epiglottis, what are the muscles? Epiglottis are pathogen. What are the muscles related to epiglottis? So you can see the epiglottis here. You can see it here, right? Larynx is very important, no guys? Okay, yeah. So epiglottis, you see it has an upper end, lower end attached to the thyroid angle. This is the anterior surface of it. This is the posterior surface of it, and 2 lateral margin. Any idea what are the muscles related to epiglottis? Brown color illa, enna color kudukalam? I don't know whether orange and all will work out. Okay, what are the 2 muscles related to epiglottis? From the sides of it, you have a muscle called the Ari Epiglotticus. Ivlo high illa, konjam keela. Ari Epiglotticus muscle. Okay, from the sides of it. And then you have a muscle called the Thyroepiglotticus. So in relation to epiglottis, there are 2 muscles. Yes. What are they? Ari Epiglotticus and Thyroepiglotticus. Right? Okay. Now coming to the thyroid. Thyroid, what are the muscles related to the thyroid? You see the thyroid cartilage here. What are the parts of the thyroid there? Yes, thyroid has an upper border, lower border, outer surface, inner surface, anterior border. The anterior border of both the lamina, they meet to form the Adam's apple. Yeah, the angle there, thyroid angle. Posterior border, which is prolonged up and down as the cornua, receiving the insertion of longitudinal muscles of pharynx. Okay. So the thyroid in the marida irukkudu. The anterior border of the lamina. Okay. The posterior border prolonged up and down. Okay. Thyroid. What are the muscles related to thyroid? Thyroid, the muscle related will be, yes, come on, tell me. You have the cricothyroid. Cricothyroid muscle will be there. Then there are three muscles related to thyroid. Okay. You have a thyroarytenoid. One more. Can anyone tell me? The ocalis muscle, right? The ocalis muscle here that you see here attaches from the inner surface of the thyroid angle to the ocal process of arytenoid. So please remember there are three muscles that you should remember in relation to the thyroid. What is it? Cricothyroid, thyroarytenoid. Please don't forget the ocalis. Ocalis is the attachment, ocal process of arytenoid. Other attachment will be to the inner surface of the thyroid angle, right? Okay. Now coming to the cricoid. What are the cricoid here? The cricoid. The cricoid has the upper border. Before that, remember the cricoid I told you, that's the only cartilage which is going to encircle the laryngeal cavity. Okay. So yeah, you can imagine it like this. The anterior arch. The anterior arch is narrow. The posterior part of it is broad. Okay. Posterior part is broad. So this is the anterior arch. This is the posterior broader part. Upper border, lower border. Yes. Outer surface, inner surface is going to face the laryngeal cavity. Okay. Sitting on top of it will be the arytenoid. What are the muscles related to the cricoid? Yes. You will have the, cricothyroid we have written, right? Cricothyroid irukkudu. Then you have the cricoarytenoids. From the anterior surface will be the lateral cricoarytenoid. Posterior surface la vandu posterior cricoarytenoid irukum. Okay, you should know the names. I'll repeat it again. Related to cricoid will be cricothyroid, lateral cricoarytenoid, and posterior cricoarytenoid. Okay. That's related to arytenoid, no? I'm coming to it. Okay. Now coming to the arytenoid cartilage. Where is the arytenoid cartilage? Here, sitting on top of the cricoid. Yeah. So arytenoid will teach like this. Can you see me? A side. Okay. So the arytenoid, it has the ocal process in front, apical process above, and the lateral process in the side. The lateral process will anteriorly receive the lateral cricoarytenoid. Posteriorly, it will receive the posterior cricoarytenoid. Okay. So muscle related to the arytenoids will be, yes, as you told, the transverse arytenoid, connecting both the arytenoid. Then from one arytenoid to the other, I'll show it in a different color. The oblique arytenoids. I'm going to tell you one important point here. This oblique arytenoid male trace panona enahum, it will become continuous with your Ari Epiglotticus. Right? Can you orient now? It will become continuous with the Ari Epiglotticus. Okay. And then other than that, I told you, yeah, it will receive the posterior cricoarytenoid in front, the muscular process or the lateral process in the back, and on the anterior aspect, it will receive the lateral cricoarytenoid. So I'll just write down the names. The muscles in relation to the arytenoid, apart from the lateral and posterior cricoarytenoid, the transverse or the interarytenoid, and the oblique arytenoids. Is that fine? Fair, okay? Yeah? Now we'll move on to identifying these muscles. Guys, it's a very important topic. Every year there's a question on larynx, laryngeal muscles, image-based question. Okay. So enna sonna endha image based question nala avasarapadadinga, identify the cartilage first. Okay, so this is a epiglottis, right? This is a thyroid. This is cricoid. Where is the arytenoid sitting there? Usually arytenoid will be masked by the muscles, but you have to remember its position. This is the arytenoid. Is that fine? Epiglottis pathachu, thyroid pathachu, cricoid pathachu, arytenoid pathachu. Now coming to the muscles here, this one, can you tell me what it is? I'll mark it first. A, B, C, these are D, E, and F. Yes. So what is A? Where do you get to see A? In the Ari epiglottic fold. Okay. Very good. Ari epiglotticus. It lies within the Ari epiglottic mucus fold. The contraction of this muscle will approximate, it will approximate the epiglottis margin and will close the laryngeal inlet. Yes, Ari epiglotticus. It is the content of the Ari epiglottic mucus fold. These bulge that you see here, these are the cornicate and cuneiform cartilage that also lie within the Ari epiglotticus fold. B, any idea what is B? End cartilage and the cartilage. See the direction of the fibers from the thyroid to the arytenoid. So it is thyroarytenoid. Is that fine? C. C enga podu? I'm sorry guys. Yeah, thyroepiglotticus. I'm really sorry. Thyroepiglotticus, going from the thyroid towards the epiglottis. See the thyroarytenoid. This is the best picture where you'll see the entire bulk of thyroarytenoid. Where in the imagery, ivlo alaha theriyadu, okay? Thyroarytenoid. C. Thyroarytenoid. Right? D. Easy. Yeah? That's the only muscle of larynx which lies outside the larynx, they tell. This is the cricothyroid. Cricothyroid. What is E and F? E on the cricoid yes, going towards the towards the arytenoid there. Muscular process I told you. This will be lateral cricoarytenoid. Pinari, this one will be the posterior cricoarytenoid. Is that okay? You have any doubts? You want me to repeat it? Please let me know. Yes, okay with it? Ari epiglotticus, thyroepiglotticus, thyroarytenoid, cricothyroid, lateral and posterior cricoarytenoid. If you're okay with that, I'll show you one more thing. This arytenoid is only. Can you see these transverse fibers and these oblique fibers? Yeah, this will be your transverse arytenoid. This will be oblique arytenoid. Can you appreciate the oblique arytenoid continuing with the Ari epiglotticus muscle? Yes? Okay. I've just reduced the size of the previous image for a reference, okay? This is another important diagram you can see here. So, enna pannu modala cartilage identify pannu. This is epiglottis. This is your thyroid cartilage. This is cricoid cartilage. This is the arytenoid. Okay, now we'll do the muscles. So this one, can you tell me guys, now you should be thorough. Yes, this is the Ari epiglotticus muscle. What is its function? Closure of the laryngeal inlet. Okay, this one is, you can easily identify transverse arytenoid. So what it will do when it contracts, it will try to pull the arytenoid together, right? It will sort of adduct your vocal cords. Yeah, transverse arytenoid. This is your oblique arytenoid. This will also try to approximate the arytenoid adduction of the vocal cords. Yes, you can appreciate the oblique arytenoid continuing with the Ari epiglotticus muscle. Now this one, yes, the posterior cricoarytenoid. What is its other name? It's also called the safety muscle of larynx, right? Why? Why is it called safety muscle of larynx? Yes, Dr. Pavitra, it's the abductor. It's inserting into the posterior surface of the muscular process, okay? going to cause abduction of the vocal cord. Yes, Dr. Swati. Okay. In that, but still it is seen. This part here, inserting into the anterior surface of the muscular process, lateral cricoarytenoid. Okay. The lateral cricoarytenoid munnadi irundhu varudhu. So that will also try to adduct your vocal cord. Okay. So the same thing here. Inga paatha adhe transverse arytenoid, oblique arytenoid, posterior and lateral cricoarytenoid. The same thing we are trying to see this in this picture. Now this is very important image. Yes. A view from above. Now again I told you identify the cartilage. Okay. Ippo idhula epiglottis therida? No. You can see the entire thyroid, right? This is your thyroid cartilage. This is your thyroid angle. Yeah, inner aspect of the thyroid angle. This thing is your posterior part of the cricoid. Can you identify the cricoid here? This circle, this is your cricoid. Ipa arytenoid enga irukudhu? This one. Can you see? This is your arytenoid. Idu therinja mattum muscle orient panna mudiyum. Is that fine? You can see the thyroid, you can see the cricoid, you can see the arytenoid. Okay? Arytenoid position note panikonga, then only you will orient to it. Now, you are going to tell me the muscle here. Can you identify the, okay, I'll just rub off the names. Okay. So this is your vocal cord, right? This is your vocal cord. It's nothing but the vocal ligament covered by the mucous membrane. Just next to the vocal ligament. Yeah. So this A. The ligament one, the vocal ligament, nothing but the upper thickening of your cricovocal membrane. Adukku just next irukkiradhu Musculus muscle. Very good, Dr. Pavitra. And just next to it, what is that? Musculus aduthu irukkiradhu. From where is it going? From the thyroid to the arytenoid. That will be thyroarytenoid. Am I right? Thyroarytenoid. Next, this muscle that you see here, any idea? Engirund enga podu? Idu cricoid, idu thyroid. So this will be cricothyroid. Fine? Okay. Now, this is the muscular process of arytenoid. Yeah, this is your arytenoid there, muscular process of arytenoid. Inserting into the anterior surface of the muscular process, I kept telling you, lateral cricoarytenoid. Okay, now you can imagine it will try to adduct your vocal cord. This one here, inserting into the posterior surface of the muscular process of arytenoid, posterior cricoarytenoid. Okay. Now, this I told you is the arytenoid. On the posterior surface of the arytenoid, this is your transverse arytenoid. Can you make out the oblique fibers here? This is the oblique arytenoid. Happy with the explanation, or do you want me to repeat it again? Let me know. Yes? Okay, can we proceed? Some response, guys. Yeah, thank you. Okay, this is very important. You should be able to orient to it. Actions easy? Yeah. Abduction, we have seen abduction of vocal cord, the safety muscle of larynx, posterior cricoarytenoid. Adduction, I kept telling you, adduction of the cartilaginous part, right? The rima glottis has an intermembranous part and intercartilaginous part. Adduction of the intercartilaginous part will be transverse arytenoid. Okay, oblique arytenoid. Adduction of the intermembranous part by the pull of the lateral cricoarytenoid. Okay, and I'm sure all of you know the answer for this. What is the tensor of the vocal cord? Yes, cricothyroid. Very good, doctor. Yeah, nice. Yeah, relaxer of the vocal cord, Musculus and Thyrohyoid. Is that fine? Okay. So abduction, just one muscle. Adduction is the moon theva. Okay. Transverse arytenoid, oblique arytenoid, and lateral cricoarytenoid. The only unpaired intrinsic muscle of larynx, transverse arytenoid. The only intrinsic muscle of larynx that lies outside the laryngeal cavity is cricothyroid. All the muscles of larynx are innervated by recurrent laryngeal nerve except cricothyroid, that's innervated by the external laryngeal nerve. Safety muscle of larynx, posterior cricoarytenoid. Okay, this is all that you should know about larynx. Okay, about just word about innervation. Yeah, a 30-year-old patient, uneventful total thyroidectomy, but after extubation, stridor. Okay, bilaterally adducted vocal cord. Just one word about the innervation of these muscles. Internal laryngeal nerve is entirely sensory. It supplies the mucosa above the level of vocal cords. External laryngeal nerve is motor. It supplies cricothyroid, which is a tensor. Recurrent laryngeal nerve, it is mixed. It supplies the mucosa below the level of vocal cords and motor to all the muscles of larynx except cricothyroid. So in this case, what is happening? There is injury to the recurrent laryngeal nerve. Okay, obstruction because of the injury to recurrent laryngeal nerve. External laryngeal nerve, inability to tense the vocal cords. Now, yeah, we have come towards the end of the lecture, but this is the most important topic, muscles of orbit. Yeah, I'm sorry why the picture got hidden. I don't know. Okay, this is the image that I want to show you that. Yes. So muscles of orbit, yeah, you know, there are the two obliques, superior oblique, inferior oblique, and the four recti, superior rectus, inferior rectus, medial rectus, and lateral rectus, levator palpebrae superioris. So name easier solidiving. Nerve supply, that is also easy, right? All of them are going to be supplied by the third cranial nerve, except superior oblique, that's going to be innervated by trochlear nerve, lateral rectus innervated by abducent nerve. Location of the muscles also easy. Okay, so this orbit will have a roof, floor, medial wall, and lateral wall. So this is the medial wall, this is lateral wall. Remember this point in your mind. Lateral wall mattunda a single muscle will be seen. Okay, roof laying rendu muscle irukum, floor laying rendu muscle irukum, medial wall laying rendu muscle irukum. Yeah. So if you see the medial wall, this is very easy to identify. This muscle which turns around the trochlea going and inserting behind the equator is superior oblique, right? Superior oblique. Adukku keela irukkirathu along the medial wall, but inserts in front of the equator. That will be medial rectus. Very good. Okay. Now coming to the lateral wall, that's the only muscle I told you, the lateral rectus. Okay. Roof la pathona, this one cut is levator palpebrae superioris. Levator palpebrae superioris is a lift pannittu cut pannada enna theriyum, superior rectus theriyum. Okay. Then floor la, I'm really sorry about this, image is not seen, but we are able to look at it from below. This muscle which originates from the floor of the maxilla, in the floor of the orbit, that is the inferior oblique. Normally, dissection la pathina muscle kaamikkiradhukku, we chip off the roof of the orbit, right? Break open the orbital plate of frontal bone. Ana in the muscle kaamikkanna, you have to open this part, okay? From the floor of the orbit, from the maxilla, inferior oblique. இங்க தெரிகிறது inferior rectus. Okay. So what could this be? நம்மளுக்கு தான் ஈஸியான இமேஜஸ் கேட்க மாட்டாங்களே. Can you identify what is the pointed structure there? Very good, Dr. Kavya. So again, easy guys. Here also I told you the clue is only in the lateral wall the single muscle will be lateral rectus. Okay. Medial wall up mala theradu superior oblique. I'll take a different color. Yeah. Mala theradu superior oblique. Adukku just keela theradu medial rectus. Floor theradu inferior rectus. Konja inga theradu inferior oblique. Okay. Roof lobe both are actually close together, but the top one will be levator palpebrae superioris and the one below will be superior rectus. So the one pointed is the superior oblique. Okay, the same thing here. Actions, you people will be very thorough. Yeah. Medial rectus ko lateral rectus ko na action when the confuse ahad, right? So the right eye, this is the left eye. Medial rectus is going to cause adduction of the eyeball. Lateral rectus will cause abduction. Right? Yes. Other than that, the superior rectus and the inferior rectus, they insert in front of the equator. So when they contract, superior rectus will cause elevation of the eyeball. Inferior rectus is going to cause depression of the eyeball. Superior oblique and inferior oblique, obliques are inserting behind the equator. So superior oblique will cause depression of the eyeball. Inferior oblique will cause elevation of the eyeball. Another thing, superior rectus, inferior rectus, superior oblique and inferior oblique. The point that you should remember is recti will adduct. Obliques will abduct. Superiors intort. Inferiors extort. Am I right? Okay. So superior rectus mattum eduthukitona, what will be its action? Elevation, adduction, intorsion. Superior oblique will be depression, abduction, again intorsion. Okay. So you can make it, I think. Okay, this was the question. So superior oblique. What will happen when there's injury to the trochlear nerve? Superior oblique, it goes for palsy. So what is the normal action of superior oblique? It should be able to abduct the eyeball. It should be able to depress the eyeball. Yes. And one more thing, it should be able to intort the eyeball. So what action the patient will not be able to perform? He will not be able to look down and outwards. Okay. So inability to turn the eyeball down and out. He'll have difficulty while reading a newspaper. He'll have a difficulty while walking downstairs. Okay. Superior oblique palsy. Okay, this is a comparative picture I put to reduce the time. Can you identify what is the nerve injured in these three pictures? A, B, and C. Yeah. Right and the left eye. Injury to the trochlear nerve. Superior oblique palsy. Just now we saw. Here, just concentrate on the right and the left. You can see, appreciate the ptosis here on the left eye. Injury to the third nerve. What is the muscle responsible for ptosis? The levator palpebrae superioris. The paralysis of levator palpebrae superioris will lead to ptosis, right? Yeah, here, this is your right eye. This is the left eye. Yeah, the left eye, here is your sixth nerve palsy, which supplies the lateral rectus. So the patient is not able to abduct, developed an internal squint. Yes. So what are the features of oculomotor nerve palsy? எதுக்கு இந்த பிக்சர் போட்டிருக்கேன்னு நீங்களே கண்டுபிடிப்பீங்க. Yes, tell me. So ptosis, yeah, external strabismus, external strabismus, dilated and fixed pupil. Okay, accommodation. Accommodation is lost. Sorry, this one thing. Dilated and fixed pupil. There's apparent protrusion of the eyeball, just proptosis sort of thing, because of flaccid paralysis of most of the muscles. Loss of accommodation. Okay. PEDAL. Tuck tucknu solidno. Mnemonic for oculomotor nerve palsy. Okay. Ptosis, external strabismus, dilated and fixed pupil, apparent proptosis due to flaccid paralysis of most of the muscles of eyeball, loss of accommodation. Yeah. Muscles of mastication, easy. This will be your temporalis muscle. This is masseter. You can identify it easily, not a problem. This will be lateral pterygoid. This is medial pterygoid. All the muscles of mastication are supplied by, so muscles of mastication, you should know the names, as I told you, temporalis, masseter, medial pterygoid, lateral pterygoid. Next, you should know the nerve supply. All of them are going to be supplied by mandibular nerve. But once there was a question, which muscle of mastication is not supplied by the anterior division of mandibular nerve? Answer another. I have put it also. Which of these four is not going to receive the innervation from the anterior division of mandibular nerve? Any idea? Medial pterygoid. Okay. The nerve to medial pterygoid comes from the trunk of mandibular nerve. All the others, they are supplied by the branches coming from anterior division of mandibular nerve. The third thing that you should be able to identify the muscles here. You can identify the muscles. Outer surface of the ramus masseter, temporal bone lerundu varudhu temporalis muscle. This temporalis will insert into coronoid process of mandible. Masseter vandu zygoma lerundu vandu ramus of mandible insert agum. There's something special about the insertion of lateral pterygoid. It inserts into the capsule of temporomandibular joint and the articular disc of temporomandibular joint. Okay. Medial pterygoid, it has two heads. The lateral pterygoid comes from the greater wing of the sphenoid, also from the lateral pterygoid plate. Medial pterygoid muscle also comes from the lateral pterygoid plate and from the maxilla. Cheri, ore question. Why are they called lateral pterygoid and medial pterygoid? Any idea? Why are they called lateral pterygoid and medial pterygoid? Both the muscles are going to come from lateral pterygoid plate. Okay, rendume lateral pterygoid plate la irundhu dhaan varudhu. But lateral pterygoid arises from lateral surface of lateral pterygoid plate. And medial pterygoid arises from medial surface of lateral pterygoid plate. Keep that in mind, okay? So, yes, now you are going to tell me protrusion. Actions they have asked in your NEET-PG question. Protrusion of mandible, the simultaneous contraction of lateral pterygoid and medial pterygoid of both the sides. Okay? Retraction is mainly by the fibers of temporalis. Melarundu ilukku retraction. Elevation of mandible, main masseter. Okay. Also medial pterygoid and temporalis. Depression is very, very important. They keep asking again and again and again. Depression of mandible is nothing but opening of mouth. What is the answer? Which muscle depresses the mandible among the muscles of mastication? During UG days, one of my friend, he told me, yeah, remember, a clue to remember is lateral pterygoid. He told that, yeah. Ladies keep on talking. Okay, that's why. Lateral pterygoid, depression of mandible, yeah. I am sure guys also talk a lot. Lateral pterygoid, depression of mandible. These are muscles of mastication. Apart from that, remember the digastrics. The digastrics, the anterior and the posterior belly of digastric, the mylohyoid. They can also depress the mandible. Geniohyoid idella. Side to side movements is by the alternate contraction of lateral pterygoid and medial pterygoid. Okay, this is to show you the lateral pterygoid and the medial pterygoid. Okay. Relations of lateral pterygoid is important. I told you it has two heads. Upper border of the lateral pterygoid will be related to the deep temporal nerves, the musculate nerve. And the lower border is very important, related to the lingual nerve and the inferior alveolar nerve. Okay, inferior alveolar nerve. But most important is, you can see the structure passing between the two heads of the lateral pterygoid. The structure passing between the two heads of lateral pterygoid. You see the artery. Any idea what is it? The maxillary artery. Okay. This will be the first part of the maxillary artery. This will be the second part. This will be the third part, the maxillary artery. And you see a nerve also. That's the buccal branch of mandibular nerve, passing between the two heads of lateral pterygoid. Okay, so you can get a case scenario something. The compression, the lingual nerve and the inferior alveolar nerve can sometimes get entrapped between the fibers of lateral pterygoid, pain radiating along the lower jaw. சரி, இதுல வந்து muscles of mastication கண்டுபிடிக்க போறோம். Easy. So here, see the ramus of the mandible. What lies on the outer surface of the ramus of the mandible? This one, masseter. What comes from above? The temporal bone. Yeah, this strip of muscle is temporalis. Okay, here, this is the ramus I told you. On the inner aspect of the ramus, the two heads. This is your medial pterygoid. This bulk is the lateral pterygoid. This has been asked in your previous NEET-PG question, the muscles of mastication, right? So, bony landmark paathukonga, ramus of the mandible, outer surface masseter, inner surface medial pterygoid. Adukku just mala lateral pterygoid, coming from above temporalis. Okay? So, cruciate muscle is masseter. Bipinnate fibers வந்து temporalis, because it originates from the temporal fascia and the temporal bone. The only muscle of mastication that depresses the mandible, lateral pterygoid. The only muscle of mastication that is innervated by the trunk of the mandibular nerve, I told you, medial pterygoid. Is that fine? Yes. Can you tell me what is the nerve supply to this muscle? கண்டுபிடிக்கலாமா name of the muscle? சரி, நான் நேம் சொல்லிடுறேன், நீங்க அதோட அதர் நேம் சொல்லுங்க. Any idea what is this muscle? Toynbee muscle. It has been asked in your previous NEET-PG question. What is the nerve supply of Toynbee muscle? What is its other name? Anyone? Guys, are you hearing it for the first time? Tensor tympani. If your muscle irukku illaya, amava illaya, where do you get to see this muscle? Guys, are you awake? Yes. Where is tensor tympani located? Am I audible? Eustachian tube within the middle ear cavity. Okay, we have come to the last part of the lecture. Within the middle ear cavity, you have two muscles, tensor tympani and stapedius. This is the anterior wall of the middle ear. You get to see the canal for eustachian tube. Adukku mela canal for tensor tympani irukku, right? This is the tensor tympani muscle attaching to the handle of malleus. This is a posterior wall where you get to see the stapedius muscle. Okay. The other name for tensor tympani muscle is Toynbee muscle. Now, can you tell me the nerve supply for tensor tympani? From the mandibular nerve. For stapedius, Dr. Prakalya, very good. That's mandibular nerve. Yes, Prakalya. Stapedius one the facial nerve. So this is the nerve of the first catch. That's the nerve of the second arch. So the function of these muscles is just to dampen the sound vibrations. So injury to the facial nerve, paralysis of the stapedius will result in hyperacusis. So the asymmetrical bipinnate muscle of the middle ear is stapedius. Toynbee muscle கேட்டிருக்காங்க. Thought you might be knowing. Tensor tympani. Right? Okay, come on. Which of the following structure passes through sinus of Morgagni? Answer is option. Very good. Okay. Yes, Dr. Kavya. Next one, the tensor of vocal cord. I'll just label it A, B, C, D. Which one? Tensor of vocal cord is cricothyroid. Very good, guys. Very good, very good, very good, very good. Which of the following not supplied by anterior division of mandibular nerve? I've been repeating it again and again. Yes, from the trunk. Action of the marked muscle. The one that's marked is temporalis. That's going to cause very good retraction. This is just a summary. Which of the following is properly matched? Okay, so dilated tubia, you notice the tensor veli palatine. Between middle constrictor and inferior constrictor, you get to see the internal laryngeal nerve and superior laryngeal vessels. Relaxation of vocal cord, thyrohyoid and ocalis. Yes. Abducens palsilla, internal sphincter. Depressor of mandible, lateral pterygoid. I just want to summarize this with all the muscles. So this picture is self-explanatory, right? Usually my first slide and the last slide, I try to make it the same. Yeah. In the oral slide, I need not tell anything. This explains everything. Previous slide. Yes. Consistency, hard work, motivation, adellame apranda. Consistency plays a very role. Okay. And that will help you to achieve your results. Okay, guys, we'll wind up the class for today. Any doubt, get back to me. Okay. You can communicate me through the Telegram. Yes. What is Preservance ridge? Preservance ridge, you want me to show the picture? Wait, yes, Dr. Shaktivel, please. I'll take you to the picture of pharynx. Pharynx, enna paathom? Nasopharynx, oropharynx irukku. The junction between nasopharynx and oropharynx is guarded by the pharyngeal isthmus. That sagittal section picture. Yes, I can show it here. Anna, either way, okay. Yeah, here. Shaktivel, a minute, please. So this is your nasopharynx. This is oropharynx. This is laryngopharynx. So when you swallow something, it shouldn't go into the nasopharynx, right? So this is your pharyngeal isthmus, guarded anteriorly by the soft palate, posteriorly by the Preservance ridge. Preservance ridge is nothing but the fibers of palatopharyngeus. From the palate, fibers of the palate going downwards. It forms a loop behind and then goes downwards. In the picture, you can appreciate it. Palatopharyngeus. Okay. These fibers in the posterior wall, they form the Preservance ridge. Preservant is named after a German surgeon. Is that fine, Dr. Saktivel? Yes. Guys, we'll wind up today's session. Thank you.